On the Profile Interview segment this week, I'll be speaking with His Excellency, the Governor of Kebbi State, Dr. Nasiru Idris. It tells me what it takes for an average state government to ensure that it has a transformative agenda for workers in its state. It's good to have you on the program.
Thank you.
Your Excellency, the first time I'll be speaking to you since you assumed office, but not the first time that we're having a conversation with you. Yeah. I spoke to you last when you were the president of Nigerian Union of Teachers and deputy president of the Nigerian Labour Congress. So I would like to ask you, a teacher, a trade unionist, and now a governor, what does that feel like? What has been the drive so far?
Well, I can say all is good because the experience that I gathered when I was the president of Nigeria Union of Teachers, the largest trade union in Africa, and also the deputy president of Nigeria Labour Congress. I didn't find it difficult when I resumed office as an executive governor of Kebbi State because I have started leadership before I assumed responsibility as a governor of Kebbi State. And you can see the Nigerian Union of Teachers. They have about, between the government on schools and the private schools, about 12.something million. And the Nigerian Labour Congress has about 20-something thousand workers under its affiliates. So I didn't find it difficult. What I did there when I assumed office, I just continue. It's not new to me to be in the hands of peers of leadership. So that is why I was able to achieve all these things that I have achieved within in less than 2 years. Honestly, and we operate an open door administration like we are doing in the labor movement. Our doors are always open. And we open government so that our people, our commissioners, advisors, members of the assembly and so on can be able to reach our grassroots people so that whatever problem they have, those can listen to them and bring it to us. We'll look at it and do the needful. So honestly, I'm the happiest person. I didn't find it difficult to operate as a governor.
Okay. Owing to the fact that we know that your experience over time leading the forefront in terms of workers and some other businesses, we would like to ask, generally, when it comes to leadership, people have high expectations. And so far from my own observations going around Kebbi State, we can't say you've fallen short of that. In governance, especially in Nigeria, or even in a state like Kebbi, we know that the welfare of workers is very important. And when it comes to the issue of minimum wage, we know that it's one topic that workers do not joke with. A few months ago, you approved 75,000 naira as the new national, as the minimum wage that the minimum that an average Kebbi worker should earn. And I'm aware that what they earned before now was 18, not even 30,000. How were you able to meet up with this wage bill?
Well, when I came, I put a committee to study all these things. And the committee comprised the representative of the labor and the government. They sat down, they look at all these gray areas, and they came up with a table. And as a labor man, I know what it means for government and the labor to agree. So initially, the labor movement sat down and came up with their own table. The government representative also came up with their table, and they put it on the table. And they extrude it. So they came into conclusion that let them adopt label table. So they brought the report to me, I look at it. And in order to show leadership by example, being a labor man, and I want my workers to enjoy that minimum wage, because I should be seen being in the forefront of governors that will be among the 5 governors that will implement the minimum wage, being coming from that extraction. So I directed that the head of service should, and the Ministry of Establishment to write a memo, and I have done the needful, and I have directed for the implementation of that 75,000 minimum wage for all categories of workers in Kebbi State, and we have implemented. Our workers have started enjoying it about 4 or 5 months ago.
When it comes to gratuity, it's a big topic, but since the pension reform, many state governments and business owners actually misunderstood what the law says as regards paying gratuity. I am aware that you're paying gratuity and you are up to date. I don't know if you would like to share from your wealth of knowledge as regards why it's important for government and private businesses to actually pay workers gratuity.
Well, what I understand is, you see, gratuity is a right of a worker after serving meritoriously maybe for 35 or 40 years. And you are expecting to have a solid money that at the end of the day, if you don't have a house, maybe you can be able to buy a house. If you have a house, maybe you want to invest that money, you will be able to invest that money so that it can start yielding something for you so that you can be able to take care of your family. So here in Kebbi State, I can recall some time back, the previous government doesn't pay gratuity in block, because that time there is a problem of finances. And when we came, we said that no, what we're supposed to do is to ensure that every worker who retires go with his gratuity in bulk, so that at least even when we leave office, that worker will say that during our time, he was able to get his gratuity in block and they invested it, or he bought a house so that he will have shelter with his family. So that is what we have been doing. And by God's grace, we will continue to do that.
Well, generally, not just as an executive governor of Kebbi State, with your experience in labor or trade unionism for over 2 decades, what's the impact of paying gratuity? If a retiree leaves service without gratuity, how would the person's life be?
That life will be very miserable, honestly, because if you are right and you are expecting after finishing your service, you will get all this thing. If you didn't get it, that is why you see in some state or maybe in some federal organization, they have been having a running battle with the pensioners, because they will say that they are not being paid for so years. But morally, a worker after retiring, he should be getting his he should also get his pension, monthly pension, which here in Kebbi State we don't play with. The day that we are paying worker salary, that is the day that we are paying pension. And every person, even our workers who died, will make sure that it will not exceed 1 week that will pay off their death benefit. So we are trying to ensure that we do the needful by ensuring that, because if you didn't pay a worker after he have retired, you didn't give him his right, that is when you are now putting him in a very bad situation, he and his family, because he rely on that money. If he didn't get it, then he will be in problem. So that is why, based on the experience that we have, when I left Nigeria Union of Teachers, my workers, they don't owe pension, they don't owe gratuity. I have handed over with a clean slate for somebody that take over from me. So I know what it means for a worker if he didn't get his benefit after retiring from the service. So that is why in Kebbi State we are doing our best, and we'll make sure that we continue to consolidate and ensure that our people get what is due for them.
Healthcare is another big topic, generally in the world of work or in any facet of life that you find yourself in. Would you want to share with us if you have any health insurance plan for an average Kebbi worker?
Yes, we have. We have Kebbi State Contributory Pension Scheme, Kachema, where workers and the government are contributing money for the Kachema to take care of the families of the worker. And also we have Kebbi State Drug Revolving Fund, where government will purchase drugs in bulk and share it to our hospitals, and our hospital will now sell it to our people within
Subsidized
a
rate?
subsidized rate, so that we'll be able to assist our people. And in the health sector, you can see, if you visited Argungu, you can see how we upgrade that general hospital. We have, and there are other general hospitals, because we feel maybe in Yauri, when there is a problem from Ingaski and Shanga local government, every one of them will try to bring transport fascia or to Benin Kebbi, either side here, specialist hospital or federal medical center. All these two hospitals have been overstretched. So that is why we awarded total rehabilitations and supply of equipment to General Hospital Yauri, General Hospital Zuru, Argungu, and here in Benin Kebbi. So that in those Yauri catchment area, they shouldn't have transport patient from that place to Benin Kebbi. That General Hospital Yauri, we now take it like a referral hospital. Whatever you get here in Benin Kebbi, you get it there. So you don't need to travel all the way from those areas to Benin Kebbi. At times when you come to this medical center and say, you see patients lying down on their floor because the facilities have been overstretched. No bed. So that is why we came up with this innovation to ensure that we reduce that overstretching of these places. We have started. You can go to Argungu, you see it, and we are now moving to Zuru. We have done Sayahaya. So after we go to, taking them one by one. When we finish the total rehabilitation, we will now put equipment, modern equipment that are needed.
Finally, unemployment seems to be the order of the day, not just in Nigeria, in Africa and across the world. What is the Kebbi State government doing to ensure that we have not just people coming into the system, but young workers, being injected into the system in terms of employment, be it at the private level or at the public sector?
Government cannot give everybody employment. That is why we are building skill acquisition centers, so that young men and women will be able to go to those places. In those where we have those skill acquisition centers, they will be trained by experts. When they finish, government will come out with a package that will give them so that they can stand on their own. Let me also tell you that Kebbi State, when I came, a lot of doctors are running away from our hospitals, because the pay rise, what doctors in the Federal Medical Center and Osman Danfodio University are receiving is far above what they are receiving. So there is any time when there is employment, our doctors are running away to go to those hospitals. I put a committee, and our nurses, I put a committee and the committee came off. I said, I want to know why these our doctors are running away from state hospitals. And they said because of the salary disparity. There are differences between a doctor of Kebbi State and the Federal Medical Center doctor. The salary disparity is about 110, so 150 highest. I said, if this thing is the thing that is making these young doctors to run away, I have agreed that every doctor will enjoy what the Federal Medical Center doctors are doing.
Great work you're doing, I must say. Thank you very much for your time.
Thank you.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.